Hi there, my name is Dr. Selassie. I mentioned in another video, maybe you watched it, that I'm the mother of 5 girls, and I'm very proud to let you all know that I had them all at home. I'm also really proud to let you know that I breastfed them, and I breastfed all of them for as long as I could. I wanted to go to 2 years, which I think is ideal. None of them really quite made it, and sometimes they wean themselves, sometimes going back to work could affect that. One of my daughters went to 22 months, and that was great. So, but any time that a mother can breastfeed her child, she should be supported in doing that, even if it's 1 day or 3 days or 6 months. Anytime that you can get breast milk into your baby, you're nourishing your baby. And on the other hand, if you can't make enough milk, which I see is a problem that's happening more and more, I think, in the modern times, then you also have to acknowledge yourself for nourishing your baby no matter what, whether it's going to pick out the best formula you know how to, whether it's going to a breast milk bank and getting breast milk donations, whatever it is. Just keep in mind that you're nourishing your child. Even if I were to say breast is best, you just want to be happy that you're nourishing your child, and any little bit of breast milk that you gave your baby is awesome, okay? And give yourself acknowledgement for that. I think that with breast milk, what women have to really realize is sometimes you have to give it some time. So it does take nipple stimulation from the sucking of the baby's mouth to help send a signal to your brain to make more breast milk, and then send the signal back to your breast to fill up your ducts with milk. That's really important. Other things that are important for maintaining breast milk is hydration. So if you don't have enough fluid, if you don't have enough water, you're not going to be able to make enough milk really for the baby to drink, because the baby has to drink, if you think about formula, you're mixing powder and water. It's the same thing when you're making breast milk. All those nutrients have to have a medium to be carried in. So if you're not hydrated, you're not going to make enough milk. Another thing that's really important is stress. And I know it's really difficult when somebody says to you, stop stressing out. It doesn't usually work. But one thing that you can do when you have stress is you can interrupt your stress. So make sure you have lots of cuddle time with your baby, cuddle time with your family, take walks in nature, take naps if you can. Make sure you're doing things that you enjoy. If you have a huge things to do list, sometimes taking care of the most important things that need to get done will feel really good. Stop procrastinating, but then also sometimes stepping away from your things to do list and telling yourself that this can wait. Trusting that overall everything will work out and everything is happening for a reason. And this is all really important for you to continue to make milk, because when you're stressed out, a stressed out mother does not make milk. There's also some really great what are called galactagogues out there. So there's herbs that help women to make more milk. So one of them that comes to mind right now is fennel, goat's rue. These are all really great teas that you can drink as tea for if you're a breastfeeding mother. There's Traditional Medicinals has a great formula called Mother's Milk that I love. It tastes really delicious. You can also get these herbs in a pill form and take it as a supplement. So that can also help you to make milk. Other things, so just in summary, is you want to definitely make sure you're hydrating well. You also want to make sure you're eating well. You want to make sure that you're interrupting stress. You're stopping stress or taking breaks out of your life in order to help you to manage stress. And the last thing is taking galactagogues like fennel and goat's rue and getting that in a tea form or getting it in a supplementation form. These are different ways that you can support yourself as a breastfeeding mother and help support your child as a breastfeeding baby. My name is Dr. Selassie, and I'm a doctor you can talk to. Thank you for listening.